Today you'll learn about the Medicare program and how to enroll in an Aetna Medicare Advantage plan. We want to help you make an informed decision about your Medicare coverage. We'll cover these important topics to help you understand more about Original Medicare, Medicare Advantage, and Medicare Part D. After the video, we'll be happy to take your questions. You should have received an enrollment kit when you arrived. If not, please ask one of the Aetna representatives for one. Your enrollment kit has an application, the overall CMS star ratings, and a summary of benefits. How do you qualify for a Medicare Advantage plan? First, you're required to have both Medicare Part A and Part B. You must continue to pay your Medicare Part B premium. Second, you have to live in the plan service area. Finally, you can't have end-stage renal disease, ESRD. There may be some cases where this doesn't apply. You should check with your plan if you have questions about ESRD. Let's get started with some Medicare basics. There are 4 parts to Medicare. Part A covers some hospital, skilled nursing facility, home health, and hospice care. You typically pay no premium for Part A. Part B covers some doctors and medical services, durable medical equipment, hospital outpatient services, laboratory tests, X-rays, and mental health services. You pay a premium for Part B. It might be paid out of your Social Security check. That premium can change each year. Part A and Part B are what's known as Original Medicare. Part C is called Medicare Advantage. We'll take a closer look at Medicare Advantage in just a moment. And Part D helps you cover prescription drug costs. Medicare Advantage is provided by private insurance companies like Aetna. Medicare Advantage plans are approved by the Centers for Medicare and Medicaid Services, CMS. Most Medicare Advantage plans combine Medicare Part A, Part B, and Part D into one MAPD plan. There are some Medicare Advantage plans that don't include Part D. With the Medicare Advantage plan, you're still enrolled in Medicare, but your Part A hospital and Part B medical coverage is from Aetna, not Original Medicare. Medicare Advantage plans are sometimes referred to as Part C plans. They include everything that Original Medicare covers and may add other benefits like prescription drug coverage, Medicare Part D, fitness, and more. Aetna is one of the private insurance companies approved by Medicare that offers MA plans. And Medicare Advantage is not a Medicare supplement plan, often called Medigap plans. Medicare supplement plans can be used to fill in the gaps in Original Medicare coverage. Generally, you can enroll in Medicare Advantage only at specific times of the year. The main enrollment time is the Annual Enrollment Period, AEP. This is when anyone can enroll or disenroll from a Medicare plan. AEP runs from October 15 to December 7 each year. Coverage then begins January 1 of the following year. The Initial Enrollment Period, IEP, is the 7-month period that begins 3 months before you turn 65. It also includes the month you turn 65. And it includes the 3 months after the month you turn 65. Also, special enrollment periods. You may be able to join, switch, or drop a Medicare plan. For example, if you move out of your plan's service area, have Medicaid, or qualify for extra help. Then, you may be able to enroll during a special enrollment period. Lastly, there is the Medicare Advantage Disenrollment Period, MADP. If you are in a Medicare Advantage plan, you can leave your plan and switch to Original Medicare. If you switch to Original Medicare during this time, you have until February 14 to also join a Medicare prescription drug plan to add drug coverage. There are several different types of Medicare Advantage plans. You can join a Medicare Advantage plan like an HMO, HMO POS, or PPO if one's available in your area. With a health maintenance organization, HMO, you'll use doctors in the network. you might need a referral to see a specialist. A health maintenance organization with a point of service, HMO, POS, means you'll use doctors in the network. You may also go out of the network. However, you will probably have a higher copay or coinsurance. With a preferred provider organization, PPO, you can use doctors and hospitals out of the network, but often for a higher copay. Medicare Part D, your prescription drug option, can include a late enrollment penalty. The late enrollment penalty may apply if you don't have creditable prescription drug coverage when your initial enrollment period is over, or there's a period of 63 days or more in a row when you don't have Part D or other creditable prescription drug coverage. If you get extra help, which we will talk about later in this presentation, you don't pay a late enrollment penalty. When you enroll in a Medicare plan, they will let you know if you owe a late enrollment penalty. If you don't agree with the penalty, you can send a reconsideration request form to the government. You can get the form from your plan. Here are some key terms you'll hear today. Cost share, the amount you pay when you get healthcare services or prescriptions. Deductible, the amount you must pay for healthcare or prescriptions before Original Medicare, your Medicare Advantage plan, your prescription drug plan, or your other insurance begins to pay. Copayment, also known as copay, the amount you have to pay as your share of the cost for a medical service or supply. This includes doctor's visits, hospital outpatient visits, or a prescription drug on the formulary. A copayment is a set amount, not a percentage. For example, you might pay $10 or $20 for a doctor's visit or prescription drug. Coinsurance, the amount you have to pay as your share of the cost for services or prescription drugs after you pay any applicable deductible. Coinsurance is a percentage, like 20%. Total drug cost, the amount of money both you and the plan spend on a prescription drug. Premium, the monthly payment to Medicare, an insurance company, or a Medicare plan for health or prescription drug coverage. True out-of-pocket costs, TROOP, the payments that count toward your Medicare drug plan out-of-pocket threshold of $5,000 for 2018. TROOP costs determine when your catastrophic coverage begins. Creditable coverage, another source of drug coverage that is expected to pay at least as much as Medicare standard prescription drug coverage. Aetna has over 60,000 pharmacies in our network, and more than 20,000 offer preferred cost sharing. With that many pharmacies, you can probably find a participating pharmacy close to you. To find a network pharmacy online, go to aetnamedicare.com/find pharmacy. Aetna has over 20,000 pharmacies offering preferred cost sharing. We want you to pay the lowest price possible for your drugs. So when you choose to get your drugs at one of these retail pharmacies, you'll typically pay a lower amount. And with so many retail pharmacies with preferred cost sharing, finding one is easy. We also have many local, independent pharmacies. Visit our online network directory at aetnamedicare.com/find pharmacy to locate network pharmacies, including those that offer preferred cost sharing. Other pharmacies are available in our network as well. Please note that members who get extra help don't need to fill prescriptions at preferred network pharmacies to get low-income subsidy copays. Every Part D plan has a network and a formulary. A formulary is a list of all the drugs that the plan covers. Sometimes our formularies change. If we change a formulary, we'll normally give you a 60-day notification. We also post notices of formulary changes to our website. You can view our formularies at aetnamedicare.com/formulary. Call 1-877-238-6211, TTY 711, 24 hours a day, 7 days a week for more formulary information. Now let's talk more about Part D, Medicare's prescription drug program. Your Part D coverage has 4 basic phases: the deductible phase, the initial coverage period, the coverage gap, and catastrophic coverage. In the deductible phase, you pay the cost of formulary drugs until you reach your yearly deductible. You stay in this stage until you have paid your yearly deductible amount, if your plan has a deductible. During the initial coverage period, you pay your plan copay or coinsurance. Your plan pays what remains until the combined costs reach a yearly specified amount. For 2018, that amount is $3,750. Once your total yearly drug cost reaches that amount, you move into the coverage gap phase. This is commonly known as the donut hole. While you're in the coverage gap, you'll pay 35% for covered brand drugs and 44% of covered generic drugs. Check the benefits of your Part D coverage, as some plans may offer additional coverage while you're in the gap. After your total yearly drug cost reaches your true out-of-pocket limit, you begin catastrophic coverage. This is the final phase. For 2018, the true out-of-pocket limit is $5,000. In this phase, you pay a small copay for generics or brand drugs or a 5% coinsurance, whichever is more. Here are some important Part D terms you should know. Formulary, a list of prescription drugs covered by your plan. Drug tiers. Each drug belongs to a tier, which determines how much you will pay for that drug. Network, the pharmacies where you can get your prescription drugs. Transition process, when you can get a one-time fill of a drug that isn't covered on the formulary. Initial coverage limit, the combined amount you and your plan pay for prescription drugs before you enter the coverage gap, or donut hole. Your plan may also have drug coverage rules which are made with your safety in mind. For example, some prescription drugs require prior authorization. That means your doctor must first show a medical need for you to use the drug before the plan will cover it. To protect you, quantity limits restrict how much medication you can get at one time. You may have to try another drug on the plan's formulary before you can move up a step to a more expensive drug. This is step therapy. If you need help with your Medicare costs, you may get extra help. This is the name of the Medicare program that helps pay some Medicare prescription drug costs such as monthly plan premium, yearly deductible, coinsurance, copays, coverage gap. Many people with Medicare are surprised to find out they qualify for extra help. You can find out more by contacting Medicare, Social Security, or your state Medicaid office, or by visiting the Medicare website, medicare.gov. There is more help you may be missing. Benefits Checkup quickly finds federal, state, and private benefit programs to help you save money on prescription drugs, utilities, taxes, meals, and more. You can find out more at benefitscheckup.org/Aetna. Thank you for your time today. Your on-site representative will now explain more about your local Aetna Medicare Advantage plans. That's what our agents are best at, providing helpful and important information so you can make the decision that's right for you. And if you have any questions about what we've just reviewed, please ask.